Irfan Pasha. I'm an ENT surgeon. I come from Hyderabad in India. I started my training in medicine and MS in ENT from Hyderabad, and then I moved to UK in 1998. I did further training as an ENT surgeon there and got through the old FRCS and the newer FRCS and the CCT. I practiced as an ENT surgeon in Northern Ireland. I was a training program director there. And after a few years, I moved to the Middle East. I worked in Saudi Arabia, in Riyadh, National Guard Hospital as an ENT surgeon and head of department. Then I moved to the UAE, SKMC as the head of ENT and a chair of surgery. Now I'm working now in Burjil Medical City as a consultant ENT. I'm the chair of the head and neck unit, Head and Neck Institute. I'm also the chair of surgery for all the surgical department. I do pediatric work, I do cochlear implants, I do advanced otology. As part of ENT, we deal with a lot of the senses. One of them is the sense of hearing. We are quite passionate about otology and children with hearing problems. It's a wonderful invention and a device of a cochlear implant which can restore the hearing back to somebody who's completely lost it. Either people can gradually fade and the hearing goes away, and which is not manageable by conventional hearing aids. So even adults can need an implant which changes the life, or children who never had hearing, where the nerves were not formed properly or the cochlea did not develop properly. The wonderful devices called the cochlear implants can restore the hearing back. So this is a surgery which I would advise anybody not to have any hesitancy. Compared to other organs where we are still struggling to give the function back, we all heard of COVIDs and losing sense of smell. Unfortunately, we don't have a medical solution yet, but hearing is one where we have a complete control on restoring it back. So fortunately, this is one of the best solutions for a child who cannot hear. So those who do not have the ability to hear because of weakness in the nerves or absence of some of the forms, I would strongly advise they seek advice from the ENT department, which has experience in cochlear implants, and there's a very good chance that this child can have his complete hearing back. Those also who lost it because of trauma or infections can get a complete restoration back. Elderly people who have lost their hearing and general ability, cochlear implant can get their hearing back. These are the patients who unfortunately feel isolated. There is a high rate of depression and even dementia. So implants are a wonderful solution, and every patient should be evaluated properly, and quite a lot of them actually deserve to have an implant, and there's a good chance we can restore their normalcy back in their hearing and the social life and communication and mixing back with the society.